When you get a prescription from your doctor, the state of Minnesota allows you to get it filled at a pharmacy of your choice. But one insurance company is challenging that law, saying it should be able to control its own insurance plans to save money. As Kelcey reports tonight, high drug prices have been questioned when customers are forced into one pharmacy system.
A giant healthcare company is suing the state of Minnesota over a state law that is designed to protect small pharmacies in rural parts of the state. Cigna filed that lawsuit late last year, challenging this law that regulates pharmacy benefit managers, or PBMs. PBMs are supposed to be middlemen, negotiating lower drug prices for health insurance plans. But the Federal Trade Commission recently reported that they are actually inflating many generic drug prices by 1,000% or more. The FTC says they are funneling customers into pharmacies that they own, where they can charge employer health insurance plans thousands of dollars for generic drugs that oftentimes cost about $30. That includes generic drugs to treat HIV, pulmonary hypertension, even cancer. In 2019, Minnesota passed the Minnesota Pharmacy Benefit Manager Licensure and Regulation Act. It allowed customers to get prescriptions filled at independent pharmacies and prevented PBMs from steering customers into those pharmacies they owned. In 2022, CVS Caremark was fined more than $1 million by the state of Minnesota for doing just that. They settled for $500,000. But now Cigna, which owns the PBM Express Scripts, is pushing back. In the lawsuit, it says Minnesota is trying to micromanage relationships between the insurance companies, PBMs, and pharmacies. This is a lawsuit that will be closely watched across the state of Minnesota and across the country, from the biggest healthcare companies to the smallest pharmacies.